Welcome to Master Lu's Health Center's podcast, where we discuss all things Chinese medicine and Chinese martial arts. Our goal is to help you achieve better health and wellness. We hope you enjoy today's episode. How you been doing, Andy?
I've been doing okay.
Okay, good. All right, well, everyone, welcome to Master Lu's Health Center's podcast, where we discuss just different things on acupuncture, Chinese medicine, Chinese martial arts, Chinese culture, and all the Asian medicine, Asian healing. And I think today we've been talking about, we're just discussing on neck pain.
Neck pain, right.
How
acupuncture can treat neck pain.
Yeah, acupuncture and Chinese medicine can treat neck pain. So What's your experience with neck pain and helping?
It's an interesting topic in neck pain, right? Because different things, different maybe injuries can cause neck pain. So as we discussed earlier, like some of the most common things that can cause neck pain is injury. Like that's number one, right? Maybe a whiplash injury can cause neck pain, right? But what are the different etiologies that can cause neck pain? They can also stem from emotional responses as well, right?
For sure.
So we have whiplash, emotional responses. Another one that we discussed was
like the immune system.
The immune system. That's right.
Immune response.
It can develop from an immune response, right? And we also have stress responses as well, right?
Yeah, even things like high blood pressure and all that type of stuff sometimes can cause some neck pain, some tension all the way up through there. We talked about a lot of times in Chinese medicine and Chinese and Asian medicine, the stress, the trauma, the environment. So like if it's even cold outside, that cold can come up onto the neck, and that will cause like neck pain and neck problems and stuff. Lifestyle,
working.
You're working hard all the time. Yeah.
Even bad vision.
Yeah,
bad vision can cause.
If you
don't have good vision, always holding your neck forward can cause neck pain.
Yeah.
So all these different reasons that can cause neck pain will often require different points in order to treat the neck pain.
Yes.
So example, like vision problem, right? More often than not, if someone has neck pain, I would treat the channel related to vision, or even behind the scalp right here, right? Directly behind the eyes, in order to treat. It's almost like finding the root cause of the neck pain in order to treat it.
Yeah.
That is not to say that the local points don't work as well.
Yeah.
So as we discussed earlier, some local points I will often use in order to treat neck pain would be around Du 14, right? The Jiaji point.
Yeah.
Also SI12, elevator scap. This is a common area too, where people always have. They have tension here. You can feel a big knot. Yeah. So what I would do, in order to reduce the amount of needles, and through experience, what I found was I will often just use acupressure. Hold this area here. Hold the area here. Find the right angle of it. Then I would tell my patient, okay, if they came in with stiff neck that day, more often right side or left side, right? I would tell them, okay, rotate your neck left and gently rotate to right. And more often than not, if I found the right point, they're going to say, oh, it feels better. So then I'll focus on that area, heat up the area as well. And I've been getting good results with that.
Oh, that's great. That's awesome. Yeah, there was an article that I found that it was a research article on neck pain and how acupuncture for neck pain relief restores circulation. And in Chinese medicine, for those that don't know, whenever there's no free flow, that's when there's pain. And so the free flow of what? That'll be like blood, we say qi, A lot of times the blood, the essential substances. So it gets stagnated, and then that stagnation, things can't flow, and then it causes pain.
Right.
And so that's where we use like the acupuncture and the herbs to help improve, restore that circulation to allow your body to self-heal. And so this article is very interesting because it talks about cervical spondylosis. And cervical spondylosis, a lot of times there you'll have along the vertebra changes in that cervical vertebra. And that those changes will cause like pinching of nerves and everything. And that's what will cause the pain. And even those cervical changes will cause like decreased motion and stuff because the vertebra is just not the same anymore. And so there's no blood supply within that the vertebrae. It's restricted, and there's degenerative changes. It's just like degeneration of the cervical spine there. So what they did, this study was done at the Heilongjiang University of Traditional Chinese Medicine. Heilongjiang is the most northern province up in city and stuff up in northern China. Okay. So there's Beijing and there's like some of the other cities, but it's up north. So Heilongjiang is really close to Russia.
Oh.
And so it's just right up next there. And so what they did is they actually used the Jiaji points along the cervical spine there. And the Jiaji points are points that go on the side of the cervical spine. And the way that we would needle them, a lot of times you can needle just straight, or I like to needle towards. So you go where the point is and you go towards the spine. And then they also used the electrics, the E-stem on those points. And they found through that research that there was great effect. The total efficacy rate of the integrated model was 90%, 90.74% efficacy.
They got good results.
Yeah, they got good results. And so just, there's lots of different studies on that. They did that in China. There's studies on just pain relief itself here in the US that have similar results on how the acupuncture can help with that pain. And I just thought it was interesting because they used it specifically for neck pain and how acupuncture is very effective for it. My experience, a lot of it has been orthopedic type problems. And so I'll have a patient come in, neck pain, and they'll have radiating pain coming down their arms, tingling, numbness, things like that. And a lot of times, before they even come to us, they've seen other physicians and stuff. They'll have MRIs done, and then they'll have herniations or bulging discs in their cervical spine, and those herniations are pushing against the nerves. And that's what's causing their numbness and their pain and stuff. And so when I see that case, I look at what channel is affected. Is it coming along the Tyehao channel, which is like the small intestine, and the UB channel all through here. For those that don't know, the small intestine channel actually starts on the hand and comes up or along the arm, comes up all the way through here, goes along the scapula, around the shoulder. It connects into the small intestine, into the heart, but also comes up through here, up behind the ear, and up to the ear here. And so the small intestine channel controls all that. And the urinary bladder channel, which is the UB channel, also comes along close to this area. I can't reach it, but along that area. And they are actually paired channels. Uh-huh. You know, the small intestine relates to the hand, and the UB channel relates to the foot. And we call them the same name channel. And so you can actually use those two channels to treat each other.
Tyehao.
Yeah, Tyehao is the Tyehao channel.
And that's called Supreme Yang, right?
Yeah, Supreme Yang. And so I will use a point pair, which is small intestine 3, which is right here, and UB65, which is on the foot. And those points are in acupuncture are shoestring points. We call it shoe points. Yeah, and the shoe points, they help with pain along the channel. And so a lot of times with the pain, those special points, we use those points to help with the pain, and it'll activate those channels. So the blood can just start flowing through.
Right.
Yeah, and then I'll use like the local points and even the Jiaji points. If it's like herniation and they're having that numbness and stuff, I will use those Jiaji points on the cervical spine to help that blood flow.
So those Jiaji points, they're right below like the facet joints, right? So right below the facet joints, that's where you find the Jiaji point.
Yep. And so that will help with like that blood flow, that blood circulation. Uh-huh. And then we, after 3 to 5 treatments, we reassess. A lot of times there's a lot of good effectiveness with doing that. Sometimes the pain will come across like the gallbladder channel.
Upper trap pain.
Upper traps up through here. And you can use the Sanjiao point. So you use Sanjiao 3 as well. And which is interesting too, because there's also an extra point called Luojian. And so Luojian is specifically for neck pain. And that, if you look at where the Luojian, so Sanjiao 3 is here, but then Luojian is down here. So it's almost similar to where it is. And it's an extra point. And a lot of times you can use the Luojian and you can push it and then have people like move their neck. And then it'll help them to move better and stuff.
So you're using acupressure to see if there's an effect on the pain, right? Yeah. In order to see, and then you needle it. Right? Yeah, sometimes, right? Yeah. But sometimes we can also go off of symptoms. Yes. Right? We don't have to always use acupressure. Because TCM also works through patterns.
Yes.
Right? So if someone's having a pattern, for example, of I've been feeling a lot of stress lately, and we'll ask them, have you had any injuries to your neck? No, I never had an injury. Were you involved in a car accident in the last few years? No, I was not involved in a car accident. No whiplash injuries, no cervical spine injuries, right? Yeah. But I've been feeling very stressed lately. How's sleep been? If they say, sleep has been very not too great, and I woke up this morning with this stiff neck. So in that case, it sounds like it's more like an emotional response or a liver response, right? Related to liver channel, not so much organ, maybe, But off of that, we don't always have to use acupressure in order to see if it's getting a result. We can also go off the questions. The patterns, that you're demonstrating. Yeah. And with that, we use the points. Right?
Say on what pattern, the medical diagnosis that they have, and use if it's like liver qi stagnation, liver problem, we'll use different points. Sometimes with like if it's a lot of stress and maybe emotional trauma, I'll still lay them. I'll treat some of the local just to help relieve, but then I will use points. So along the UB channel, you have the organ systems, and I will use even the second line of the UB channel,
the outer shoe points,
to help with the emotional. So if you have the heart shoe point, and you use the outer of it, the second line, that helps with the emotional problem. So I'll use like maybe the heart and the liver to help with their emotional state, with their stress. Because so many, like what you were just saying, a lot of people, they carry stress.
Right.
They just carry up all the way up to here, and they wake up, they have neck pain, and they just carry all their stress in their neck. And that'll cause, a lot of different other things, headache and dizziness, and their energy could be low. All of that.
More often than not, if we do local points, have you found through your experience that it's a bit effective, right? It still could be effective, right?
Yeah.
But we often want to find the root cause of what's causing the neck pain.
Yes.
Right. So, for example, like we mentioned the different ways that someone can get neck pain, whether through injury, right? Yeah. But like another way that we haven't talked about is like the right side, right? Through my research, right side dominated by liver channel. So someone with big belly, right, like a fatty liver or excess liver, right, that liver will press down on a nerve right around your inguinal area, right, and that nerve comes all the way up around to C3 on your neck. So if I find someone that has neck pain, right, and I see big belly, maybe they're complaining about right-sided hip pain, growing pain on the right side, immediately I'm thinking liver channel, right?
Yeah.
Focus more on release the liver, right? And that will have an effect on the upper trap pain as well.
Yes.
Not to say that local points won't be effective as well.
Yeah.
But we're also trying to find that root cause of what's causing the neck pain.
Yeah, that's why a lot of times I think we do use like distal type points, because in Asian medicine, I mean, we look at the root cause of what's going on.
Right.
And you have to use other points to help, that the constitution of the body and what's going on within the whole body, and
you look at the body as a whole.
The whole thing.
Right.
Because they're having neck pain, which is right here, but there's a lot of things that can cause that neck pain, not just having the neck pain. And so, especially if they're having like high blood pressure and they're just not eating good, and the stress, I mean, there'll be different points that we will use to help with that, whether it's on the foot, on the hand, on the stomach, that we look at what's going on there, what imbalance is happening. And so, I think it's very effective.
You can also look at the channel as well.
Yes.
One method I like to use, we call them fire points, right?
Yeah.
Right. And I will see if those are active by pressing on them.
Yeah.
And if those are active, let's say SI channel, right? Let's say if the fire point in the SI channel is it's painful to touch, but they're here for neck pain, I will find a good results, right, in reducing the pain on that point using distal points. And if this area, right, were to relieve in pain, that will have an effect along the channel, which goes around it, like to your upper neck. So if someone comes with upper neck pain and I find, hey, this point is kind of painful, right? I will reduce pain on that area using distal points. And that will help. That will effectively help the neck pain. Reduce the symptoms at least a little bit.
Yeah, that's very good. Yeah.
As well as using local points too.
Yeah, I think it's very effective. I think a lot of people too, they don't realize that the environment, whether the weather changes stuff. So like even when the weather changes exacerbate the pain, that could be, a lot of people with arthritic problems, the weather affects their pain. So when it's cold outside, it's rainy, that will cause the more pain. And in Chinese medicine, we always attribute that to like being maybe like a wind, damp cold, or damp coldness, or cold dampness. And that cold stagnates the channel, stagnates the blood, it constricts and physically constricts. And so that's why there'll be pain. And so in those cases, I like to use the warming type techniques, whether We use like the moxibustion, and that will help move the blood flow, warm the channel, so that body can start to heal.
Increase circulation to the area.
Yeah,
bring more blood, more chi too.
More chi and herbals. We use herbs that will help clear wind, transform dampness, warm the channels. And so there's different formulas. One formula is called 火漏丸 that will help with the blood flow, the blood circulation, especially in the neck. There's 羌火圣食汤. That one helps with clearing the wind damp, coldness, especially in the upper part of the body. So not only like neck and head, but even those arms and stuff, torso, upper part. It'll help clear the wind, damp, and warm the channel. So it'll help with the pain and stuff. So it'll help, open it up. And
so one thing we also discussed was what can bring the pain back. Because often people come to see us, right? And they feel better afterwards.
Yeah.
They'll probably feel better for about 2 or 3 days.
Yeah.
And then they say, oh, yeah, it was feeling good. And then it came back. Yeah. More often than not, I tell them the reason why is, you just need more acupuncture, right? Yeah, if it worked the first time, I don't see a reason why it wouldn't work the second time. But often lifestyle is involved in the reason why pain comes back, right?
Yeah.
So we talked about typing earlier and having bad posture, right? Yeah. And also like if you have bad vision and you're not wearing your glasses, you can effectively bring back that neck pain.
Yeah.
Right? So lifestyle is a big thing, and exercise plays a big role on that too.
Oh yeah.
So something I always tell my patients is if you're not moving that joint, if you're not moving it, your body's very intelligent. Right? Mm-hmm. It's not going to send blood to areas that you're not going to use. I mean, it is a little bit, but not as much as it probably needs. So if you're not exercising, that's going to be a big factor into your neck, your stiff neck, right? Yeah. So I was telling you the other day, right? I often use acupuncture. If I'm experiencing something that's painful, I will use acupuncture to get rid of it. But before I do that, I try different modalities. I'll use massage. I want to see if it's effective. I'll try exercise. Exercise is very effective in reducing, because if you in reducing the pain, tension, or stiffness. Because if you're exercising and you're moving that joint, you're bringing more circulation to that area, and then when you bring more circulation to that area, that stiffness seems to go away.
Yeah, definitely. I think the exercise is very important. Anytime I have patients with neck pain, the stretching would be very important. Yeah, stretching. One stretch I think is very good is the side to side. So in Tai Chi, we practice what's called Baduanjing. Baduanjing is an old Qigong form. There's 8 exercises, and one of those exercises helps with the neck. And what we usually do is you put your hands behind your back like that, and then you stretch back and you do left, and then you turn right. And when people have, stiff neck, you could practice this, to where there's the stretch, but no severe pain. So you just want to go to where you're able to go. And over time, the neck will get more loose, more circulation through there to help with that neck pain. The exercise, even using things like heat at night and stuff will help. Using a heating pad like that, just to get that mobility, reduce the pain. The lifestyle, like what we just mentioned, is very important. I'll treat people that are always at a desk job all the time. They'll have some type of neck, shoulder type tension and stuff because they're on the computer, they're doing things like that in the posture. Yeah. And so you have to take time in between your day to realize, okay, I need to take time to stretch. I need to take time to move. Because you're all like this every day. We could do all the acupuncture you want, but then the next day you go back, you're like that every day. It will come back.
It's gonna come back.
You know? It's even the same way, you know, I'll treat people, they'll feel really good. They'll do all this, you know, they'll be able to do more. And then they say, oh, my neck hurts. Yesterday I pulled the weeds. I went gardening. Yeah. You know, I felt so good. Or I go shovel snow. And now I'm hurting. Right. So, well, that's why, you know, you overdo it. Yeah. And that's part of the ideology of even Chinese medicine is overwork, overdoing it. And so that causes disease. And so that's why you just have to listen to the body. You know, you take, and it's difficult. Sometimes we're not conscious. We just keep working. We keep doing the things we're doing, and we don't realize it. Yeah. And so, but sometimes it just takes a conscious effort to think, okay, I got to take some time. I got to stretch. Yeah. I have this problem. I need it to heal.
Some people, they need to do those things, right?
Yeah,
it's part of their job. Like
they have to do it too. Yeah.
I had someone, right? He has rods like going down his neck. Right? He already had the surgery, right? Mm-hmm. So there's already gonna be a loss of motion. You're not gonna get that back, right? Yeah. It's gonna be there. Would it help them? Would acupuncture still help them?
Yeah.
Through my experience, yes. Yeah. It reduces their tension a lot on their neck.
Oh yeah.
So much so, like, because like they can't move already. You already have the bones are fused, or you have rods that's preventing the neck from moving.
Yeah.
Right. So, like, there's nothing I can do to help you with that motion, but they're still gonna have stiffness. That stiffness, I have had a lot of experience in reducing that stiffness.
That's great.
So that the person that I was treating can return to their lifestyle, do their work. They're gonna get the tension again. They come see me and they're like, oh, I have the tension again. All right, we'll repeat what we did last time, and then again they feel better.
Yeah,
you know? So it can help with people who have who had surgery in the past. Yes. Had fusion. In the past. Will we not be able to regain that motion that they once had, but we can reduce the tension around that surrounding area.
Yeah. And I've treated people with all sorts of neck surgeries and hardware rods and stuff. Yes. And it helps. It's effective. It'll help with continually with that blood circulation and the blood flow there to help it there. But after surgery, it's always hard because they cut, and then that causes the trauma. That causes blood stasis, blood stagnation, things like that.
Scar tissue.
Yeah, scar tissue, and the flow is not going to be the same. And especially when they put in hardware, the flow is not going to be the same. And so then, what you're just saying, that the movement's going to be different, but the acupuncture, the herbs, the exercise will help it. I treated one guy before. He had probably about 6 or 7 different neck surgeries. And he had all sorts of hardware and screws and bolts and stuff. But the acupuncture always helped with managing that pain and that soreness and help him with his range of motion and stuff.
So for that particular population, the ones that had surgery and had fusion already, I would recommend them have a maintenance program.
Yeah.
Like once we have the pain levels at a level where they can function, like again, you're gonna do things in your life, especially if you have fusion, that's gonna repeat the pain, right? And that's when I say a good maintenance program would be good for you. So come in 3 times a week, right? Maybe the first week or 2. And it'll help a lot with the pain. Yes. Now that we have it at a level that that's manageable for you, let's see you once a week or once every 2 weeks. See which one works for you, right? Yeah. So a good maintenance program would be great for that type of population.
Oh yeah, definitely. I think that because the more they come, especially in the very beginning, you'll have the relief care, and so the more they come closer together, it'll build upon itself because acupuncture is cumulative. And so every time they come in, and then once we get good relief, then we can start spreading it out, separating the treatments. And that's just like the more of the care and then the maintenance care after that, where, every quarter or something like that,
right,
they could come in just to maintenance and then do the Tai Chi, do the exercise, to maintain therapy, having good nutrition and all of that. All the nutrition's important because that will help with the nerves and the muscles,
yes,
and everything. And doing those type of things will help prevent it from getting worse. And even a lot of people that have had surgeries, over time, they'll have even more arthritic changes because of the surgery and stuff, and that'll increase the pain. And so you have to do that. Those things like the exercise, the nutrition, even the acupuncture and stuff, just to prevent from all those other, like the arthritic changes, the arthritis. And stuff.
It's good for your longevity.
Yeah,
the physical
good for
movement.
your longevity.
So I know a lot of people want to exercise, but they often tell me, but it's painful. Like I want to, but I'm in pain.
They can't.
That's when I tell them to come see me.
Yeah.
So when should they come? Like when should they try exercise or massage or heat before coming to see an acupuncturist? Right? Mm-hmm. I believe like try all that. And if it doesn't work, then definitely come see us.
Yeah.
For acupuncture.
Yeah.
Because I have tried massage before, and you get knots in your back from lots of exercise. Mm-hmm. Tried heat, right? Physical exercise. They benefit. They help reduce the pain. It's when you notice that it doesn't go away, like it keeps there. It's still there, right? Stuff. Like kind of like a stuck feeling.
Yeah.
Then come see me for acupuncture, and then like for days or weeks you're gonna feel better. If you move incorrectly, if you're not doing the right exercises, the chances of it coming back is pretty high.
Yeah.
But if you had good results the first time at acupuncture, we can repeat those results. Yeah.
Sometimes with neck pain too, if we did a series of acupuncture treatments and there isn't any changes and stuff, there could be a underlying more pathology to that, whether it's like a tumor, cancer, things like that. Or I treated one guy before, and he had neck pain, but he had surgery before. And he had like rods and stuff and hardware, and he had the pain. And so we were looking at it, and we did the acupuncture and stuff. I think we did it a couple of times. And on the third treatment, the second treatment, he felt okay, but there was still a lot of pain. It was just like really sharp and stuff. And the third time, he was just having a lot of pain. And so he went to the physician, and they did the MRI, and it turned out what was happening is one of the screws got loose and was poking out of his neck towards him. And so that's what was causing it. And so, I mean, those type of things too, I thought at that time, if there's, if we do a series of treatments, like 10 treatments, and there's just like no changes at all, there could be an underlying pathology, whether it's cancer or something a little bit more serious than just, arthritis and stuff like that. It will be more like like cancer or tumor.
More serious thing.
That's coming along. Sometimes people will have bone cancer that would be causing it too, and they don't know. I treated people with cancer that had multiple tumors along not only their cervical spine, but along their spine. And that causes pain. And so that's a different type of pathology and different ways that we're going to have that we would treat, or we would, in conjunction with a physician, treat, because you refer out saying, okay, there's something else going on.
Right. So the evaluation process of acupuncture, very important to figure out where is the neck pain coming from. Like what caused the neck pain? Is it coming from an injury? Is it coming from a channel pathology? Is it a serious condition such as tumor, cancer? Exactly.
But I think overall, though, that we use the exercise, use the Tuina, which is the Chinese medical massage, cupping. Cupping is very good for, especially when the muscles are tight and stuff. Treated a lady this morning. She had, up in the neck, shoulder, and then so we used the cupping up there too, and that the cupping will help improve the blood flow, the circulation, and then the acupuncture will help relieve the pain, relieve that neck pain and the neck tension, and but also looking at what that root cause, whether it's stress related, or trauma related,
surgical related, right?
Yeah, surgery, and we treat those root causes. Try to help heal your body by itself. But using those modalities and the acupuncture and the Chinese herbs, all will help just naturally help your body with that neck pain. Yeah. Any other thoughts on the neck pain? Other experiences you've had?
I like to differentiate. Like by neck pain, some people have upper trap pain, right? So upper trap a little bit different than neck pain, right? Some people will have stiff neck here, but other people will have tension on their upper traps.
Right up to here.
So we would treat that differently as well. Right? Upper trap is kind of sometimes more like stress. People hold their stress on their shoulders. Right? So we were talking about earlier using Sanjiao 3, UB50, 52, you said?
UB65.
UB65 for the stream points and helping relieve the upper trap points. The upper trap tension. Right? Local points can help. I have found through experience though, if sometimes when people have a lot of tension on their upper trap, and you don't use distal points, afterwards it'll feel stuck a little bit. Like it'll be more like kind of like a little bit more tension. So important to using distal points as well for upper trap pain. Or neck pain.
I think with that upper traps using both, and use the distal, some local, and then the other things like the massage and the cupping and stuff.
So I have a question for you. How many needles do you usually go for? Is there a certain amount that you won't pass? Because I know different acupuncturists use different amounts of needles, right? But one thing, like I'm trying to, in my approach towards acupuncture, is trying to use the fewest needles possible in order to get good results. You aim towards the same thing.
That's what I try to do. I think it's an ongoing process. I'm still at the point of, 15 to 20 needles. I want to cut down to even 10 to 5 needles. But I'm always still like, I got to, treat this way, that way. But I don't go past like at least 20 needles. So if it's over 20 needles, I say, okay, you got to do this way different.
But why? Why won't you go past 20 needles?
Because I think if you're using too many needles, if you get up into like 30 needles, 40 needles, 50 needles like that, it's going to deplete the energy out of the body.
Deplete energy.
Yeah, and it's going to confuse the patient's channels.
Right.
So there's a I don't know if you call it phenomenon, but there's a thing called channel confusion.
Yes.
And channel confusion could be like if someone comes in and they've tried all these different things, all these modalities, or if someone did acupuncture and they used all the channels and all these points, then the body gets confused.
Almost changes like the function of acupuncture.
Yes. And then the body won't be able to heal. And so you have to treat that. You have to kind of reset.
Yeah.
And I give an example. It's an herbal example. I see a lot of people, they're taking all these different supplements, and they want, this supplement or this herb for this condition, that herb for that condition. They got this, so they're taking another one. And because they're taking so many, then their body's not able to heal, and they'll get even more problems, anxiety, stress. And I had one guy who was doing that. And so then I said, okay, take out all of those and just take this formula, this herbal formula, and it'll help everything else. And he did. It helps him. And sometimes I think our mentality is more is better, right, and stuff, but it's not necessarily true. Sometimes you can treat the body using like 4 or 5 points, and it'll help reset. It'll help with healing the body. I think a lot of times, this is just my own opinion, is because of using 15, 20 needles. Not only in school we use that, but then sometimes people will think, you only put in like 4 needles in me.
Yeah.
What's going? It's a psychological thing. Why am I paying you to put in 4 needles and that's it? Yes. Even though they feel better and stuff, it's some psychic thing.
That more equals better, but not always the case with acupuncture. Yeah. Now there won't be any, really the risk for acupuncture is very minimal. Yeah. Right. So as a clinician, as a beginner, it's almost like we always gravitate towards more. Yeah. But through experience, I'm trying to reach that level of trying to get the best results with the least amount of needles.
Yeah, with the least amount of needles. And my father, he always used between maybe 5 to 10 needles. That's about it.
That's impressive.
Yeah. And so he would just, use a few needles, and he had really good results. And I think a lot of times it just takes more confidence in ourselves to treat in that way. There are people that are treating using 1 to 2 needles, but you have to see. Sometimes it's hard because of the patient's mentality as well. Even though it helps them, sometimes they just feel like, I need some thing. I've done classes with people that practice the Master Dong style of acupuncture, which is a distal style of acupuncture. And they would just use, like with the neck pain, they'll use only the distal points, a couple of points.
Reflection points.
Yeah, and they would help, with the neck pain. But then they would even say, and sometimes the patient will say, hey, can you just stick in a couple of local needles there? And it's a mentality thing, And so, I like to try to minimize it as much as possible, though, too, and not do too much, because it will confuse the body and will cause channel confusion.
Almost like you're putting too many needles in the body, so we're not getting, I guess, the results we're looking for, because we're confusing the function of the needles in your body as well.
Yeah. And so a lot of times, if someone comes in and they've done all these different things and it's just not helping, their body could be confused because there's just too many different things that they were trying to do all at once. And it just puts that pressure, that stress on the body, and the body's not able to heal. And so Dr. Wang Zhiyi is an old Chinese doctor, and he talks about channel confusion, and his point combination to just at the beginning to help somebody with that channel confusion was the 4 gates, large intestine 4, liver 3. So he'll just use 4 gates to help the body reset and not be confused. And then he'll treat what their main complaint is afterwards.
So he would start off with the 4 gates, right? Unconfused body.
Yep.
take out needles and then go into
he'll
local points?
He'll treat the first treatment will just be 4 gates only.
Right.
And so he'll treat the 4 gates and then leave them there 20, 30 minutes. And then he'll take out the needle and then they'll come back the next week or whatever. And then he'll treat the other way. And so it's almost like the analogy is kind of like an onion and you're peeling an onion. And so you have to treat at different layers, to help out. And so the first layer of that channel confusion would be that top onion. So he'll use the 4 gates to help with the channel confusion. And that's where point pairs are very effective too, because sometimes you can treat, like for example, the neck pain. We've been talking about neck pain. If it's the right channel, the right diagnosis, then you use the SI3 UB65, and you just use those 4 points bilateral, and then that's it. And you let them be for 20, 30 minutes. You treat it, and then maybe use some heat up on their neck, and then they come back 2 days later and you see how they're doing and stuff. And then you can start, maybe some local points afterwards and stuff like that. But some people, though, it's the psychological they want. You're not treating my neck. Wait, I need some point there. So you have to stick some.
Someone asked me that one time. How come acupuncturists, when I tell them I have pain here, they say, okay, they'll put a needle over here. Yeah. I'm like, well, okay, because for us, we see the connection, right? This area here connected to this area here, right? And although we would like to put needle there to reduce your pain, we want you to have no pain. Well, we're also cautious. What if there's inflammation here, right? If there's inflammation here, maybe putting a needle there won't be the best bet. So we'll use points to help reduce inflammation, which will probably be in the distal area, around the hand, the webs of the fingers. So that's the reason why we don't always put a needle exactly where the pain is. Not to say that we don't always do that, but we look for what's the cause, right? We don't want you to go out there having more pain after acupuncture.
Very good. Well, I think it's great, talking about neck pain, and those that do have neck pain or any other pain, acupuncture, Chinese herbs, Tai Chi is a very viable option to help with your neck pain. And you can always contact me and Andy over at Mass Lou's Health Center. Our website's louhealthcenter.com, and you can contact us there to schedule an appointment to come in and talk to us and get some acupuncture treatments done. Thank you very much.
Thank you, everyone.
Thank you for joining us. We hope you enjoyed today's episode. Please like and subscribe to the podcast and YouTube channel. We'll see you next time.